Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, depression is a serious medical illness that can affect all aspects of the lives of millions of Americans. It can cause changes in mood, thinking, behavior, and just overall well-being. Here to tell us more about today's topic of depression is Christel Rinehart. She is a certified mental health nurse practitioner from Mayo Clinic Health System. Christel, thanks for joining us today on Speaking of Health.
Thank you for having me here, Jason.
Well, today we are talking about depression. How common is depression? It would probably surprise a lot of people.
Depression is very common. It's one of the most common things that we see people in mental health for. In fact, we call it the common cold of mental health. It's estimated that 19 million Americans suffer from depression. 25% of women and 15% of men will experience depression sometime in their life. It's the leading cause of disability in the United States, and it affects the way a person feels, behaves, and acts.
Well, you know, no one is 100% happy all of the time. Everyone gets sad or depressed at times in their life. But when is the sadness a sign of major depression?
Well, for some people, depression symptoms are severe and very obvious. For others, they may feel miserable or know that something's not quite right, but don't know how to pinpoint it. It affects people in different ways, but there are some common symptoms that we frequently see. Those are a continuous feeling of sadness or irritability, finding no pleasure in things that they used to find enjoyable, sleeping problems, either sleeping too much or not having the ability to sleep at all. Sometimes people feel very tired all through the day, even though they sleep up to 20 hours a day. They often have no energy to complete the tasks that they need to get done in a typical day. Some people find that they eat a lot, while other people have no appetite whatsoever. Feelings of worthlessness or guilt are very common. Also, depression is often accompanied by feelings of anxiety. People often find that they have trouble concentrating, and especially find that they're very forgetful, forgetting doctor's appointments, forgetting to get the kids, all sorts of problems with memory. Crying spells are fairly common, as well as a loss of interest in sexual activity, and some people have recurrent suicidal thinking or thoughts of death.
And when it gets to that point where it's thoughts of death, suicidal thinking, it's pretty serious.
Yes, if it's more than just a passing suicidal thought that maybe you'd be better off dead, if you're actually experiencing, finding that you're thinking about suicide throughout the day and are thinking of a plan to end your life, then it is an emergency and you should seek immediate help.
You know, all of these symptoms, and there are a lot of them for depression, do they vary by gender? Do men depression symptoms, do they differ from women depression symptoms?
The symptoms of men do sometimes vary than what we typically see in women. In men, we're much more likely to see irritability, and men often turn to alcohol and drugs more so than women do. This is a common thing that we see, that maybe men think that if they drink, it will make them feel better. Also, they're used to trying to solve problems on their own, and so they turn to alcohol or drugs to find a relief of their depression. However, that just seems to make things worse in the long run. Also, I think men, because they want to solve things on their own, they're less likely to seek outside help.
How about kids? Do you often see depression with children, teenagers?
It is a little different when we see teenagers or kids with depression. A lot of times kids don't recognize that what they're feeling is symptoms of depression, and they just know that they don't feel happy. So they have a lot more acting out behavior. Also, you might find that they're more isolative. If they used to spend time with the family watching TV, you might find that they're in their room the majority of the time when they're at home. Also, you might see a change in their regular activity. If they used to enjoy hanging around with their friends or being involved in sports, they might show that they have no interest in that.
So what causes depression? Does it have to be something major stressful happening in your life that causes you to be depressed, or is it something else?
It's not necessarily a major event, although some major events may be a trigger for depression. Some common things that we see are after the loss of a loved one, somebody is experiencing unemployment, if they have had a baby, or if they suffered abuse. That is often a trigger for depression. We do know that depression alters the chemical functioning in the brain. There's 3 main chemicals involved in depression in the brain, and those are serotonin, norepinephrine, and dopamine. And people with depression have an imbalance of those chemicals. So it is actually a medical component. There is a reason people are feeling that way. Also, depression is more common in women. As I said, 25% of women and only 15% of men have depression in their life. And we think that reason that there is an increase in women, one of the reasons is that there's a hormonal imbalance that occurs like with pregnancy and after pregnancy, or the monthly cycle that women experience, as well as when women are going through menopause. Those can all trigger to depressive symptoms. Also, we have found that there is definitely a genetic component. A family history of depression makes you more likely to have depression yourself.
Does it have to be immediate family, like your mother or father suffer from depression, or could it be, a little more extended?
Most of the time it is seen in the parents, but oftentimes if it's not a very strong family tendency towards depression, it may be further down the line, such as a grandparent.
How about, let's say, for example, I suffer a major death in my family and I am grieving. At one point, does that change from grieving to possibly depression? Is there a certain time length that you look at?
Well, everybody experiences grief and the grieving process differently, but generally, the normal grieving process lasts 2 months. That's not to say that after 2 months you should go back to feeling like nothing happened. But generally after 2 months you start to realize that life has to go on and you must go on with it. But sometimes the major event like that will trigger a depression, and the chemicals in the brain can start to get imbalanced, and it can lead to a depressive episode. The way to tell the difference is that basically if it's longer than 2 months and you're still in the grieving process, or it's really affecting your ability to function throughout the day. If you're not able to carry out the tasks necessary for living independently, then you should seek help.
So how is depression diagnosed and treated, and can someone actually be cured of depression?
Just like diabetes or some other chronic illnesses, there is no cure for depression, at least not in our present understanding of the illness. But it is very amenable to treatment, and we have many options for treatment available to us now that even within the past 10 years, our options have grown tremendously. The first step in getting help is to actually ask for help, and you should talk to either your doctor or a primary care provider, a friend that maybe has experienced the same symptoms, or a member of the clergy. And it's important to remember that depression usually doesn't get better on its own. It usually needs some intervention.
And is it diagnosed, is there a blood test you take or an x-ray, or how is depression diagnosed?
Actually, at this point, we don't have the ability to have a test that will say, yes, you have depression, or no, you don't. It involves seeking care from a mental health care provider and going through what your symptoms are, how long it's been present, what you have found helpful, and what has not been helpful for you.
So treatment, what is there available for treatment? Is there hope for people with depression?
Their treatment is very effective for depression. The scientific evidence right now says that a combination of psychotherapy as well as medication is the best treatment for depression.
And when you say psychotherapy, that's counseling. A lot of people would know that as counseling, right?
Yes, it is.
Mm-hmm. And medications, what kind of medications are there out there, and are they getting better as we move forward in the future?
There are many classifications for antidepressants. Some of the older medications we used to use frequently were the tricyclic antidepressants. We've had the serotonin reuptake inhibitors. Right now, most people respond to the serotonin reuptake inhibitors well. There has been new medications on the market just within the past 5 years that have shown made real difference in people's lives.
So I've been feeling very depressed for several months, and I come to Mayo Clinic Health System for my first appointment in the behavioral health department. What should I expect?
At the Mayo Clinic Health System in Fairmont, we have a team of mental health care providers. We have Mark Anderson and Brian Coranda, who are psychologists, as well as Annette Bremer, who is a licensed therapist that provides psychotherapy. In psychotherapy, it's a way of seeing how your thoughts and behaviors can affect your feelings and what impact they have on your life. Through that process, the goal is to establish healthier ways of living, taking into consideration how your thoughts and feelings affect the way you behave. Also on our team, we have Anita Handevet and myself, and we are nurse practitioners, and we handle the medication management for depression. When you see Anita or myself, it's not much different than going to any other healthcare provider. We start with an assessment process, look at what symptoms you're having, and then try to tailor an approach to treatment that targets those symptoms with regular follow-up.
So it sounds like there definitely is a lot of hope for people out there that are suffering from depression, and a lot of those people probably feel like they have no hope.
Depression is very treatable. Many people suffer for a long time needlessly because the help is available. The medications and psychotherapy can make a real difference. The first step into getting help is to actually ask for it. So it's good to either ask your doctor, find a professional person that can help you with these problems. Stick with your treatment plan and talk to your provider about any problems you might have with that plan so they can tailor it to fit your needs. Educate yourself about depression and what you can do to treat that yourself. Pay attention to your warning signs and notify someone if you notice increase in your symptoms. Avoid alcohol and drugs, and try to be active. We know that exercise actually releases those chemicals that make us feel good.
You know, and when we were talking earlier about men and depression and the stigma of the illness that there is out there, do you think that that maybe hinders some people from coming in when it really shouldn't at all, because this is a medical condition, just like diabetes, like you said?
It is, and I think, you know, with education and public awareness, that stigma is diminishing. And I think that when you come to see us, you will see that we are just like your other providers. We're specialized in mental health, and we're treated as a condition that is treatable and benefits from the services we have available.
So, Christel, are there things that people can do besides obviously getting professional help from someone like you? But are there things that people can do for themselves to help them deal with depression?
Well, yes, there are. There's things that people with depression, as well as people that don't suffer from depression, can benefit from, and those are to exercise regularly. Recommendations are at least 5 days a week for 30 minutes. Like I said, those exercise releases our natural feel-good chemicals. Also, a balanced diet is important. What's healthy for the body is healthy for the mind. Allow time for yourself. We get caught up in our requirements of the day and what our expectations are, and we forget that we need to give ourselves some time. We are important. Find ways to find de-stressing time for yourself, even if it's 15 minutes a day. And try to lead a balanced life. If you think that work is important and family is important, you need to be just as important as well. There needs to be balance in life.
Well, unfortunately, that's all the time we have here today. I'd like to thank our guest today, Christel Rinehart, certified mental health nurse practitioner from Mayo Clinic Health System. Thank you for joining us.
Thank you, Jason.
And to make an appointment with one of Mayo Clinic Health System's behavioral health specialists in Fairmont, you can call 507-238-8598. Thank you for joining us today on Speaking of Health. Have a great day and be healthy.